So let's talk about weight loss for a little bit. Why exactly is it so difficult for some of us to lose weight as we get older? Why is it sometimes much more difficult, and I see this a lot, for men to lose weight as opposed to women losing weight? Well, what's important for us to understand that there's a lot that goes into gaining weight and there's a lot that goes into losing weight. And losing weight is a lot more than just how many calories I ate versus how many calories I burned. So let me explain a little bit further. What does that mean? There are lots of factors, and one of the most important factors to understand is understanding your hormone balance. So what are hormones? So there are lots of different hormones in our body. We have lots of what we call sex hormones, which are things like testosterone, estrogen, progesterone. But there are other hormones like cortisol that are very important in your metabolism and you gaining or losing weight. Other hormones like thyroid hormone. I think most of you probably have heard about thyroid hormone, and in fact, most of you have thought you may have had thyroid issues when you couldn't lose weight and you were told your thyroid was okay. However, most of the time that thyroid has not been fully assessed, and the thyroid hormone typically does play a major role in your ability to lose weight. So when I talk about hormone balance, I mean, your hormones are, I would like to call it a unique, complex web that all of these hormones need to be balanced. And what I find is that hormones have been neglected by most physicians, and particularly in women. Hormones have been thought about with this negative kind of connotation or a taboo type of feeling. And in fact, when hormones are balanced, both men and women, their brain function better, so they have more energy, it's easier to lose weight, they're more motivated. So I would encourage you, with bioidentical hormones, they are safe. What we've been told in past years is that hormones are typically associated with cancer and heart disease. Well, with synthetic hormones, yes, that may be some of the case. But when hormones are done appropriately and monitored appropriately, they offer immense benefits with respect to those things that I mentioned. Many women are suffering with symptoms of hot flashes, night sweats, hair loss, brain fog, weight gain. And unfortunately, those things are never addressed. In fact, a lot of times these issues are addressed with medications like antidepressants and anti-anxiety medications, when in fact, if we were to balance our hormones, they would feel so much better. Men, for example, men have that losing that motivation, loss of libido, erectile dysfunction. Again, when we address underlying hormonal imbalances, that motivation returns, libido improves. And so I would encourage all of you, if you have not had hormone evaluation, that is something that would change your life, particularly as you get older. And from a longevity perspective, it's something that can be done safely and offer tons of benefits from your overall health perspective.